Now, obviously, the biggest development in weight loss and obesity and so on in the last few years is the GLP-1 drugs, Ozempic, and I think everyone's heard of it's the most commonly one, Ozempic, Wegovy. There are all sorts of different drugs, and everyone says, "Oh, this has revolutionised the weight loss industry," and it's everyone should be on Ozempic, and everyone in Hollywood's on Ozempic, and we should all be losing weight through Ozempic, and I think we all accept that these drugs are effective in weight loss. There's no doubt that they are effective, but I certainly have some concerns about them. And what's your feeling on these drugs?
We are creating an epidemic of osteoporosis and fragility that is going to be unseen of to this day. In future generations are just going to fall over and snap their hips, and here's why. So, and this is drug company funded research. So one of the studies where they're actually using to submit to the FDA to get the original approval for these drugs, they looked at their weight loss, and they actually did DEXA scans, body composition scans, and they were having a look at how much muscle and how much bone and how much fat they actually lost. And they found that something like 40% of the weight that the subjects lost was actually muscle or bone. Now, and that is absolutely huge, especially when you consider that we're often using them in people at a stage in their life when we'd really want to be optimizing their bone health. We don't want to be setting them on a pathway of osteoporosis.
How does that compare to when you lose weight through, say, a low-carb diet, for instance? What sort of a percentage is from muscle and bone then?
Look, it varies. It's in a lot of cases, you can actually increase your muscle and bone on a ketogenic or low-carb diet. It will often be associated with some muscle loss, but it would be, it would be less than, 3%, 5%. It would generally be very low. And if you're prepared to make sure that you are having a higher protein form of diet, you don't necessarily lose any muscle at all. And frequently, I have patients who, when we do this BMD, bone densitometry scanning, DEXA scanning on them, they actually increase their bone density at the same time that they're losing weight. And that's simply not possible. So this is why we tell people to exercise and eat protein if they're taking Ozempic or something like that. The reason is because we know it's so bad for the bone health, it's so bad for muscle. We know that lean muscle mass, in terms of biomarkers, is probably one of, if not the strongest biomarker that can predict longevity. So what is causing these people's muscles to waste away doing for their overall longevity? Now, here's the other problem, though. So we know that, over this 12-month period of this study, we had this wasting. Then they stopped it. Now, there was no suggestion at all that they had actually reached the limit of muscle or bone loss. The assumption being that what was implicit within this study was that if they had continued taking this drug, then bone loss and muscle loss would have continued to accrue. Then they actually did a follow-up to this study where after the 12-month period they stopped it, and then they had a look at the weight regain, or if there was any, after 12 months of stopping it. And invariably, they found there was something like 40 to 60% of the weight that was initially lost had been regained. Now, interestingly, they did not present the DEXA scanning data on whether the weight that they regained was fat, muscle, or bone. And for the life of me, for a drug company funded study, if it had have been muscle and bone that had come back, I imagine they would have been singing it from the rooftops. So we'll just let that one there. So what we know, and anybody's welcome to correct me if I'm wrong, is that the longer you take these drugs, the more bone you lose. So you can't stay on it forever because you're just going to end up with no bone, weak bones. And when you do eventually stop it, on the balance of probability, you're going to regain the fat, but your bones aren't going to get any stronger. Now, we have an alternative. You can go on a ketogenic diet where you can actually increase your muscle mass, you can increase your bone strength, and you can lose the weight at the same time. And all the important biomarkers of health that are associated with longevity will improve. For the life of me, I don't understand how anybody in good conscience conscience can prescribe these drugs for patients wanting to optimize their long-term health.